what is hepatitis B and hepatitis C?
B and hepatitis C are both infections of the liver. It is usually, it is always caused by a virus. It principally infects the liver and may lead to liver damage, which can be quite severe.
Doctor, how can we get hepatitis B and C?
Transmitted usually through injection or blood or contaminated blood products. Contact with infected blood may lead to hepatitis B. Birth to an infected mother can lead to hepatitis B in the newborn, and sex with an infected partner can also cause it. If you use an injection, then if the needle is contaminated, then it can give rise to an infection with hepatitis B or hepatitis C.
Why it is important to treat hepatitis B and hepatitis C?
If you don't treat a patient with hepatitis B and hepatitis C, especially if they have got long-standing, what we call chronic infection, then, as I said previously, it can give rise to liver damage, which in our terminology we call cirrhosis of liver, and it can also give rise to cancer in the liver. Hence, it is extremely important to treat it once it is detected.
Doctor, who is at risk for hepatitis B or hepatitis C infection?
If the mother is infected with hepatitis B, then she can transmit it to the baby. Hence, it is important to screen pregnant mothers for hepatitis B and take appropriate action. Similarly, with hepatitis C, it can be transmitted, but the chances of transmission are low. Injection, those who abuse drugs, those who take intravenous drugs, they can also get hepatitis B and C because of infected needles. Similarly, if the blood or blood product hasn't been properly screened for hepatitis B and C, then you can get it if you are given blood or blood products. Household contacts of persons who have hepatitis B, we always screen them and take appropriate action because they have increased chances of getting hepatitis B and C. Healthcare workers should always be given vaccination and where appropriate screened, especially if they are associated with blood or blood product like dialysis technicians, etc.
Doctor, how do I know? I know if I have hepatitis. Doctor, how do I know if I have hepatitis B or C infection?
Hepatitis B and hepatitis C infection in initial stages is asymptomatic. This is a big problem because when you get the infection, most of the times you don't have any symptoms. Hence, it is not detected. Sometimes you might get very non-specific symptoms like body pain, joint pain, nausea, etc. Once you start getting symptoms of liver disease, then what we call you have advanced disease. This is one of the problems with hepatitis B and C because when you have got mild disease or initial infection, at that time you don't have any symptoms. When you get symptoms, you have advanced disease.
Doctor, what precaution can we take to prevent hepatitis B or C virus?
The thing that we should keep in mind is vaccinating babies and children. It is imperative that all children and babies